everyone. Welcome to another episode of Tattoos and Telehealth. Today, me and Kelly are going to be talking about struggles with chronic conditions that maybe you've been told your labs just look normal, you're fine, it's just stress, there's nothing more we can do, we don't really know what's wrong with you, but you're still struggling with some complaints of maybe gut health, maybe sensitivities, maybe chronic fatigue, maybe always feeling run down, hormone imbalances. So, Kelly is double board certified in functional medicine. And today I want her to talk to you about what functional medicine is because it was super, super enlightening to me because that's not something, that I specialize in. I specialize in family medicine and healthcare law, and she specializes in family medicine and functional medicine. And I had no idea the capacity that functional medicine held. And so today I really want Kelly to talk about her approach, how functional medicine can help those of you who are struggling with these chronic issues. Maybe you've been doctor to doctor to doctor. Maybe you have just been struggling for so long you've given up hope. Um, so that's kind of what we're going to touch on today. I do want to say that this is not to be perceived as medical advice. We're just two gals just chatting it up. Also, watching or listening to this podcast does not constitute a patient-provider relationship. If you want to be our patient, you can go to hamiltontelehealth.com and you can click on Get Care Now. And so, Kelly, so take it from here. Some of your experiences, I know over the last, even just the last month, we have really, I've kind of picked your brain about functional medicine because I'm more curious about it myself. And, you've met with these patients, spent a lot of good quality time with them. And then sometimes you have these diagnoses, and I'm like, that's insane. Like, that you were able to come up with that. I know you order certain testing. Sometimes it's a stool test. Sometimes it's all it's a swab, like sometimes it's blood tests, like just those extended tests to just try to figure out what's going on with patients that are really just struggling with these conditions and they haven't found the help they can get. So talk to us a little bit about that and what kind of things you can help with and assist these patients to really get to feeling better.
Sure. So, functional medicine really has been around for a long, long time. It was originally, I don't know what it was originally called. I think you and I called it holistic medicine. And then it's just kind of changed the way, the nomenclature over a period of time, but it truly is a head to toe approach for your patient. It's a very personalized, patient-centered approach, which, in my opinion, my professional and personal opinion, is the way medicine should always be. I think that's what, it was always intended to be. It never should have become the powerhouse that it looks like now. And so functional medicine lets me get back to the root of medicine while allowing me to snuff out the root cause of what's going on with people. So it truly focuses on treating that individual and their specific circumstances. And that may be genetics, that may be their environment, their lifestyle, their nutrition, and it uncovers that underlying dysfunction rather than just managing their symptoms, what I call a pill for an ill. There's nothing worse, in my opinion, than having a patient come to me, whom I just saw one recently this week, in fact, that laid out this plan of pills, and she's like, Kelly, I'm just tired of taking all these pills. What can we do? And at the end of this, hour and 10, hour and 15 minute appointment, I was able to pull three of those pills away in exchange for one peptide injection. Um, that probably is going to be more effective for her because, as we've talked about before on our podcast, peptides are more effective. One, they're injectable, they go straight to the source, and it's something that your body makes naturally. So you're not fighting with this, swallow the pill, get it through your intestines, go through the stomach, do all the things. It's got to be absorbed, it's got to go here, it's got to go there. And so we pulled off three pills that she's having to take every day in exchange for this peptide that's going to make her feel so much better. And so that approach, it really appeals to those that are frustrated with that traditional medicine approach. Patients come to me and they're like, I don't feel good. Something is not right. And I hear that so often. And, I know that you appreciate it and I appreciate it, especially at this stage in my life when we're perimenopausal, we're feeling all these feels, stuff isn't right. And you go to your provider and he's like, well, your labs are normal, you're fine. Go do yoga, go meditate, get some sunshine. I'm sorry. Like I know you get frustrated with that, right?
Yeah,
Like,
those things are good for you, but it doesn't solve all the problems. And patients want to understand, and they want solutions, and they want,
but
and sometimes sunshine is the solution. Sometimes it is, right? But sometimes you just need to dig to find out why versus trying to put a band-aid on things. And I think that's where the extreme value of what you're doing is, let's figure out the root cause. Your visits are 45 minutes to an hour because it's, you're going to dig up some stuff, right?
yeah, so instead of just treating the symptoms, it's not a one size fits all. We aim to identify and address the functional causes of diseases, and what triggered them. What, again, like it goes back to whether it's genetic or environmental or nutrition, what triggered it. And so, when you come see me, this is for example, you're going to fill out extensive paperwork. There's a reason. When you fill all of that extensive paperwork out, I'm reviewing that extensive paperwork. And when we see each other, after we spend a few minutes chit-chatting, getting to know one another, we're going to go through every single question that you filled out in that paperwork. And we're going to touch base on every single section, whether it's lifestyle, social, sleep, um, nutrition, everything. We're going to go through all of it together. And then that helps me to suss out what a day in the life of Nicole looks like, what a week in the life of Nicole looks like. And that gives me a really good sense of who you are as an individual, where you've been in this journey, what medications you're taking, what your diet, exercise, stress management, sleep, nutrition, everything, what everything looks like. And it helps my brain to figure out, what do I need to do to help restore balance in this person who feels off. I don't care that in the moment that your labs say you're normal, because normal may not feel normal. And normal has a wide range. It goes back to, like I tell patients with vitamin D, normal is 30 to 100. That is a huge window. You may not feel normal until you're way over here at 80 to 100, which ideally is where you should be anyway. Um, we were not meant to be stuck inside all day long with no sunshine and vitamin D and living way over here under 30, even though 30 is normal. We need to be way over here. That's where we feel good. That's our foundation. So during this approach, we suss out all of these things. And, I had a patient that, by the time she came to me, dealing with all of these issues, I won't get into specifics about her, but by the time we got her GI mapping results back and her zonulin testing back, her markers were so significant for inflammation. By the time we were able to pull some stuff out and get her treated and get her inflammation under control, within a matter of a couple, 3 weeks, she was feeling a ton better, a ton better. And there's nothing like I get chill. I'm getting chills right now thinking about her, because there's nothing more exciting than having a patient come back to you saying, I feel so much better. I feel better than I have in years. I'm sleeping. I have energy. I feel rested because someone listened to them.
Priceless right
Someone
there.
listened to them and found something that no one else had found, realized that it was this inflammation in their body causing all of these issues. I get on this soapbox and I feel I'm getting on it right now. Like I can feel myself getting worked up. But inflammation, guys, inflammation does so much to you. Inflammation destroys your stem cells. Inflammation will tear your body down. It destroys your immune system in your guts. It will make you sick and fatigued and feeling like life is horrible. It gives you this sense of everything is bad. And so,
Your body stress, right? Like it's like
uh,
your body on extreme stress.
yes, it is this chronic fight or flight that your body goes through. And until you can rein that back in, like I have two patients right now, two very similar situations with both of them. Both of them are displaying symptoms of an overinflamed immune response that looks like hives and anaphylaxis and like both of them, like
Wow.
breaking out in hives, the skin reaction. They can't eat anything, drink anything without their whole body just going berserk, like a full-on body attack,
Wow.
because their systems are so overloaded. And I'm trying to help them rein that back in. One of them is doing fantastic. I've been taking care of him for several months. And we finally have his system under control by going through this process. And it's been a process, because I tell people, you didn't get there overnight. We're not going to fix it overnight. But we've finally gotten his immune system to settle down. We've put the flames out. Now we're just smoldering the smoke. And I have another lady whom I have been visiting with recently, that we just finally figured out that was this overactive immune system histamine response. And we've been able to slowly add in things to rein that back in under control. And she's starting to feel better. But it's what happens when doctors and nurse practitioners and other providers, we're all guilty of it, look at the person and say, well, your labs look fine. Well, her labs did look fine, and they do.
The
But
ones that are ran, but you're like, no, we need to run different labs.
yeah,
I mean, there's millions.
yeah, by the time I got everything else back and I listened to what she was telling me and saw what was happening in her body, and we realized that there was this overwhelming inflammation happening in her gut, that was the trigger that said, here's what's happening. Here's what's going on. And when we get those things under control, then you can start seeing everything getting better. And I think people oftentimes feel like they have to take that answer from their provider. Guys, you do not. You do not have to take that answer from your provider. Functional medicine steps in and says, there is a root cause for what's happening. We just need to find it. We just need to listen to what's happening. We need to keep digging till we figure it out. It's not always going to be simple, but that's what we do. And that's why I love getting to spend 45 minutes to an hour with my patients, digging and digging and digging until we figure out this is what's going on. And it's rewarding. It's rewarding for me. It's rewarding for my patients. If even if I can help them go from, you know, 6, 7, 8 hours of feeling just like they've been run over by a truck to having maybe 2 or 3 hours of a great day, then I've done something for them.
Yeah. How often do you follow up with your patients when you meet with them? Does it vary based on the patient, or does it require?
So it really does. It varies. And depends on kind of what we're doing. So the initial appointment is going to be an hour, maybe an hour and a half, kind of depending on them and what we were talking about. And then we go through extensive testing. And I really base that next follow up on when I get all the results back. I like to wait until I get everything together and I've had a chance to sit down and review it all. And then I have the team schedule that person for a follow up to go over everything again. And that may be 2, 3, 4 weeks before we get everything back and get a good clinical picture. So it starts out at about every 3 to 4 weeks initially, until we get a good picture of what we're treating, and then spaces out to about every 4 to 6 weeks, depending on what we're treating and how we're treating it. And depending on the person, I tend to lay out a list of several things that we need to address. And I'll take 2 or 3 hot topics first and we'll address them, check them off the list, take the next 2 or 3, check them off the list. And we just take little bite sized pieces because what I have found doing this for so long is that once you hit those big trucks and knock them out of the way, these little things down here tend to fall into place and no longer are an issue.
I love it. I love it. I know some patients, they're more like quicker, to figure it out, and sometimes it takes longer. And so, when you go to your primary care, this reminds me, when you go to your primary care and it's something with your heart, they send you to the specialist, to a cardiologist. It's something with your kidneys, you go to a renal doctor. But when there's something with the body and they just can't figure it out as a whole, it's functional medicine. That's the specialist. And so it's really neat because you're trained in Western medicine and primary care and family care, but this extra specialty kind of takes it beyond for your patients to say, hey, this is not just something that, standard run of the mill type of thing, right? Let's really see what's going on with you. And sometimes it's genetic testing, sometimes it's all kinds of different. It just depends on what the situation is. But I like that you take like the top three, what are your biggest complaints? Let's work on knocking those out. I think that's great. And I know we opened up more appointment slots for you to be able to do that because it does take some time, especially the first one. So if you're looking for a functional, just have a visit, just have one visit. Like there's no subscription, there's no trickery, right? Just have one visit with Kelli and just to see if you feel like it's something that she can help you with. It's not like you're locked in. We don't make you, sign a contract. Just if you think that you could benefit from meeting with Kelli, go to hamiltontelehealth.com, click on Get Care Now. It just asks you basic stuff, very quick, name, date of birth, da 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 da. I think like the last question is reason for visit. There's a other at the bottom, which we probably should add functional medicine, but just click other. We'll reach out to you and get it scheduled. Like it's super, super easy to schedule with her. And we've opened up some more slots. So I'm super excited for patients to really get the relief they need. Because I know I send patients to you. Sometimes I'm like, you know what? I just don't know. And so I know you just figure it out. And I absolutely love that.
And I love it. I love spending time with people, and it's always interesting because I learn almost as much from my patients, I feel like, as they learn from me. Because, medicine is evolving. We all are, and we learn from each other, and I think that it should always be that way.
Yeah, absolutely. Well, thank you guys so much for joining us today. Again, this was a topic on functional medicine. You can find Kelli at hamiltontelehealth.com. Click on Get Care Now. And or you can always send us a message at 407-550-5441. You can shoot us a text and just say you're interested in functional medicine, and we will point you in the right direction and get you scheduled with Kelli. Make sure you have a little bit of quiet time set aside, because you're going to really get into it with her to make sure that nothing is missed and no stone goes uncovered. So thank you for joining us. Hope you guys have a wonderful, blessed week, and we'll talk to you soon.
Be sure to like and subscribe, guys.
Bye.
Bye.